Hi Tia, how you doing?
Good. How are you?
I'm good. My name's Leah. I'll be the nurse helping you out today. I heard you had some concerns about the Huntington's disease. What are some of your concerns about this?
Well, it runs in my husband James' side of the family. Um, I'm really concerned that he may end up with it because I've watched both his father and his grandfather suffer. Um, I'm curious about the disorder and want to know what to expect if James does get it.
Okay. Well, I'm glad you came in to talk. I'll be happy to provide you with as much information as I can. Other team members can provide your husband with genetic tests to use, risk factors, and ways to lessen symptoms if he so wishes. May I ask what family members on your husband's side have the disease and how old they are?
Yeah. Um, Both my husband's father and grandfather have the disease. His grandfather was 82 when he passed away from complications.
Okay.
His father's 61. He stays at the nursing home near our house. He's not doing so good though, so we aren't expecting him to make it much longer, unfortunately. Um, he's in pretty bad shape, but I'm kind of like just curious, is this going to happen to my husband?
Well, unfortunately, I can't give you a yes or no answer to that question without doing some tests first. I understand your concerns, though, and I want to provide you with as much information as possible so you can understand the disease a little bit better and prepare yourself if your husband does end up with the disease. I know this can be a really scary time. It sounds like you're correct about the disease running in the family, though. This is an autosomal dominant disorder. Have you ever heard of this?
Autosomal dominant? I don't think so.
Okay. Well, autosomal dominant is one of the several ways that a trait or disorder can be passed down through families. If you inherit the abnormal gene from one parent, you can get the disease. Often, one of the parents may also have the disease. As you said before, both your husband's father and grandfather have had the disease, so it does sound like it was passed down from father to son.
Okay.
Huntington's disease is a very complex disorder that causes the breakdown of nerve cells in the brain. Unfortunately, it can cause movement disorders, thinking disorders, and psychiatric disorders.
So, does this mean that my husband's chance of getting the disease is much higher because both his father and grandfather had it?
Well, any child of a person with the disease has a 50% chance of inheriting the trait.
Okay.
So there is a 50% chance that he could inherit the gene. Let me ask, how old is your husband?
My husband and I are both 28, and 50% sounds pretty scary. That sounds like it's a high inheritance rate. Does that mean that there's a good chance he's going to end up with the disease? And I don't think that he's thought about genetic testing yet.
Well, the disease usually starts to make an appearance in the mid-30s to 40s, but it can occur earlier or later depending on the person. Do you think genetic testing would be something your husband might be open to?
He's normally pretty open to stuff like that. I'm not quite sure that he's thought about it because we've never discussed it, but I can definitely bring it up to him.
Yeah, that would be a good idea. It can be really difficult with a disorder like Huntington's disease because it is unfortunately a fatal disease. It really can affect families.
Right.
But sometimes people don't want to know that they have the gene because it just causes too much stress and trauma.
Well, what would the testing entail so that I could tell him about that?
Well, a blood test would be taken and your husband's DNA will be closely looked at. After about a week or so, the test would come back with either a positive or a negative result.
Okay.
If he does test positive, other tests can be done to see how far the progression of the disease is. There can include neurological examinations and sensory examinations, and other things that can be looked at are psychiatric symptoms and neuropsychological testing.
Okay. And if he does test positive, why would we have to get all those additional tests done if they already know, oh, he's positive for Huntington's? What does the additional things tell you?
Well, like I said, it's a very complex disorder. Doctors and scientists are working every day to try to find a way to slow the progression of the disease. Unfortunately, there is no treatment at this time, but as I said before, there are medications that can lessen symptoms. Multiple interventions can help a person adapt to their changes of abilities, which is where other healthcare team members would join us and help us make some more decisions.
Okay. Wow, I guess that's a lot that would have to change if he tested positive. We would have to rethink everything, our entire futures.
I understand that the thought of this can be scary, and I'm sure that the two of you have already gone through a lot together, considering both your husband's father and grandfather have had the disease. Would you mind telling me how your family copes with this?
Yeah, well, our family's really close, thankfully, and we have each other to talk to if one of us is getting down. James had a really tough time, as did I, when his father had to go to the nursing home. He hates seeing his dad in this condition, and honestly, no one likes to see their family in this condition. He's a completely different person than he used to be. That's really hard. We had a family counselor that comes to the home to help us with some coping strategies, and she comes a few times a week. I think it's helped a little bit. I mean, it gives us some tools, I guess, to use.
Okay.
So it's just such a devastating thing, and that's why I'm so nervous James will end up with the disease. I mean, what about having kids? That's something that is absolutely been something I think about for my future, and I feel like it's completely off the table now. I just feel like I couldn't have children if they have the potential of inheriting this fatal disease.
Well, it's nice to hear that you're so close-knit with your family. It's always helpful to have the ones you love the most there when you need them through times like this. I'm also glad to hear that you've been open to a family counselor. I know you said it helps a little bit, but they definitely do provide some really great tools to help with coping strategies. So if that is working for you, I would definitely recommend keeping that going, and try to, be open to maybe some other things that I could share with you towards the end of our session. It can be very useful to bring the professional people in to help with these sorts of things. I know it can be difficult to think about the chances of future children getting the disease. This might be a good reason for James to have genetic testing done. If he tests negative, then he will not pass the trait down to his children. Having the testing done could potentially ease your minds and allow you to move forward with future planning, children. Ultimately, this is a decision for the two of you, so I would strongly recommend talking and making a decision together. Like I said, there can be many emotional consequences that come with a positive test result.
Yeah, I'm really worried about that, but having children is really important to me, so I think that James getting tested would benefit us more than anything. Like you said, this is definitely a conversation that we need to sit down and really lay out all the pros and cons to having the test and make sure it's something that he wants to do, but I think it's really important for both of us.
Great. I'm glad to hear that you'll be discussing the matter together, and it might be a good idea to bring in other family members, such as your mother-in-law, which is his mother. She would be a really great person to bring in. She might be able to really help you, give you some advice on how it's been dealing with her husband. I have a pamphlet here on the basics of what you need to know about the disease. That includes how it occurs, the effects it has on the body, the different tests, examinations that are done, and different support systems as well.
Awesome. Are there any support groups around here that help with family members that are dealing with people affected by this disease? Because I think it would be great to get my husband and my mother-in-law involved so that they could maybe cope a little bit better.
Well, the pamphlet that I just handed you does provide some support groups that meet different times during the month. I've heard really, really great things. I would definitely recommend checking it out. So why don't you give me a call back once you talk with your husband, and we can all sit together and talk a little more about our options.
Okay.
Also, if you would like, you can bring your mother-in-law in.
Right.
I think that she would really benefit from coming in and help with the decision-making possibly, if that's something that your husband so wishes.
Okay. Yeah, that sounds great. I'll talk to both of them. I'll talk to James about what we've discussed here today. I'll talk to his mother about potentially coming with me, if she has any advice on how it's been dealing with someone who developed Huntington's. Yeah, I'll have to talk to them and get back to you guys.
All right, perfect. Well, do you have any more questions for me?
No, but I'll take this pamphlet home and I'll talk to everybody. Thank you for all the information.
Oh, you're very welcome. I'm glad I could help, and hopefully I'll be seeing both you and your husband soon.
Yes, thank you.
Thank you.